good afternoon and welcome to the Escape Hatch to Wellness. And today I have the pleasure and really the privilege of introducing someone who has had a very positive impact on my personal life, Dr. Vijay Jain. And with Vijay, he has had more than 40 years in general surgery and integrative medicine, interweaving in their Ayurveda and Panchakarma. He has been trained with Dr. Deepak Chopra with mind-body medicine, with Dr. Andrew Weil with integrative medicine, and also with regards to yoga therapy with the Vivekananda Research Center in India. So, as I said, it's an honor and a privilege to have you here with my Escape Hatch to Wellness talk about the pillars of wellness and all of your knowledge and experience condensed into one interview, which I know is not possible. So welcome, Vijay.
You're most welcome. This is a privilege for me to get together with somebody I know for last 7-8 years. And I've done many interviews, but this is the first one with functional medicine, so it'll be interesting.
Well, I think with the integrative medicine and functional medicine, there is some similarities to the two of them with their approach. I think in some ways, maybe integrative medicine is a little bit more mind, body, spirit than functional, but functional is moving in that direction. Would you agree with that?
Correct.
Yeah.
Yes, I would agree with that.
Well, if you wouldn't mind, I mean, you became a medical doctor, traditionally trained as an MD, and then got into integrative medicine, Ayurveda, and Panchakarma. But do you mind sharing with the viewers your journey to that trend? That's a big leap from traditional to non-traditional.
Correct. Actually, it's an interesting story to tell at this point. Of course, it was not that interesting when I was going through it. Back in 1989, when I was at peak of my surgical career, I was a general surgeon and laparoscopic surgeon. I was chief of the surgery and chief of medical staff at my 300-bed hospital. Very stressful time, but my practice was booming. And at the peak of my career, I got a autoimmune condition which affected my muscles in the both the girdles, shoulder and pelvic girdle, and my swallowing mechanism. So I ended up being diagnosed as polymyositis, adult onset polymyositis, which is another way of saying inflammation of muscles, multiple muscles. It's a condition with no known cause. And Mayo Clinic in Rochester, Minnesota, they treated me with high doses of steroids and chemotherapy, including methotrexate and endoxifen. Interesting thing was that it was probably the first time in my life I had a crack in my ego structure. We'll come to that in a later time. But that was very interesting because I was sitting in the neurologist's office in Rochester, Minnesota, and I was being told what my diagnosis is, and my neurologist said, I would want you to take a sabbatical for 6 months. And I said, you don't understand. I'm a very important person. I'm a chief of staff, chief of surgery, and I chair so many committees. The hospital cannot run without me. And he was a little bit older than me, and he listened to me, and he said, Vijay, let me tell you the bad news. That 2 weeks after you leave to go on your sabbatical, people will say, Vijay who?
Oh, that was a bit extreme.
So I started crying. That's probably the first time anybody had told me that I cannot walk on water because everybody thought I could, and I thought so too. Anyway, so the medical treatment, I remember distinctly asking my internist or neurologist, is there anything I can do to help my recovery? And He said, no. I said, what about diet? He said, no, diet has nothing to do with it.
Oh my.
So because that is how we are trained in modern medicine, we got 1 week of training in diet and nutrition. Learned about carbohydrates, fats, and proteins, and minerals and vitamins. Step cycle, how does a calorie uh, count begin, and all that stuff. But just about a week in 5.5 years of training. So we really don't know. I cannot blame the physician for that, but we were not exposed to nutrition. At any rate, I went in recovery for a few months, then go back into exacerbation, then improvement. It was like a seesaw for next 7 years. So I'll go back to work for a couple of months, then I have to take a couple of months off. So it was quite stressful to continue these high doses of steroids and chemotherapy for 7 years. At which time I was introduced to Yogi Amrit Desai because I was told that he has a different perspective on healing. Before that, I knew Deepak Chopra, so he had asked me to come to his clinic, and I said, "No, I don't think I want to go into Ayurveda because I know in India, when we went to medical school, the students who went into Ayurveda were the ones who didn't get admission.
Oh.
So I said, no, thank you, but I'm not interested. So when I met Gurudev Amrit Desai, he said, you need to study Ayurveda and get Ayurvedic treatment. So he sent me to India to Dr. Joshi in Nagpur. And before I could visit him, he said, you need to go and study yoga. And so I went to Indian School of Yoga in Bangalore, studied yoga, yoga nidra, yoga therapy for 3 months. And then I went to see Dr. Joshi. To make the long story short, it took me about 2 years, 2.5 years of multiple panchkarmas, and we'll come to that in a little bit, which are detoxification program, because in Ayurveda, all diseases are caused by accumulation of toxins in the body. And we'll talk about what those toxins are. And I did a lot of work at the level of mind. It took me 2.5 years to completely get rid of the modern medicine. And then I've not had any recurrences since then. It's been like 20 years now that I've not had any recurrence of the problem. But that opened my eyes that, what we were dealing in modern medicine is the gross aspect of our existence. Anything I can see, feel, smell, taste, listen is what I thought was the truth.
Mm-hmm.
But our senses don't give us the truth. There is a part of us which is, now that I'm in Ayurveda, I know that 99% of our existence is non-material.
Mm-hmm.
So which you cannot experience through the senses.
Mm-hmm.
But in modern medicine, we were dealing with the effect of the metabolism of experiences in the past at the body level with drugs and medicines.
Mm-hmm.
And that also very ineffectively, because we didn't take care of all aspects of the gross. So now that I understand that there is more than the physical body, the physical body is the tangible aspect of who we are, but the intangible aspects, which are mind, how does the mind affect our body? How do the emotions affect our body? How does our choices affect our body? how does our belief systems, our ideas, our memories, our what we believe in, what choices do we make, they all affect our physical body.